Right now, something may already be changing inside your brain, and you wouldn't even realize it unless you knew exactly what signs to look for. You clicked on this video for a reason. Maybe it was the title. Maybe it was fear. Or maybe it was a quiet thought you never say out loud, wondering what might happen if a stroke began and no one was there to help you immediately. Here is the unsettling truth that many seniors are never told. A stroke does not always strike like a sudden lightning bolt. Many strokes begin quietly, gradually building pressure, slowly reducing blood flow, while the person is still awake, still speaking, still believing everything will pass. During those moments, the brain is already struggling for oxygen. Every second counts, yet most people freeze because they simply do not know what to do. Let me make this very clear. I am not talking about miracle cures or anything that replaces calling emergency services. I am talking about what can be done in the short window before help arrives. That window is often only a matter of minutes, and science shows those minutes can determine how much brain tissue survives. Now here is the part that truly deserves your full attention. Researchers studying stroke response have found that certain immediate actions, when done calmly and correctly, can help support circulation, oxygen delivery, and brain stability while waiting for help to arrive. These actions do not stop a stroke, but they can influence how severe it becomes. In this video, I will guide you through 5 critical actions seniors should take immediately before help arrives, ranked from the least impactful to the most important. Stay with me until the end, because the number 2 action involves a simple 3-minute technique that researchers have found can significantly affect outcomes when used at the earliest warning signs. The studies behind this are listed in the description below if you want to review them yourself. Before we continue, I want to ask you directly, how old are you and where are you watching from right now? Leave it in the comments. We read every single one because this information could help protect not only you but also someone you care about. Now stay focused, because we are starting with number 5. And most people never realize just how important this first step really is. Number 5. Loosen any tight clothing around the neck and chest. The moment you notice that something is wrong and stroke symptoms are appearing, whether in yourself or someone close to you, the first physical step you should take is to remove any tightness around the neck and chest area. This is not a traditional remedy or a myth passed down over time, but something supported by well-established vascular science that emergency doctors have recognized for many years. When you wear a buttoned collar, a tight necktie, a closely wrapped scarf, or even a necklace resting firmly against the skin, it creates external pressure on the carotid arteries, which are the 2 main blood vessels on either side of the neck responsible for delivering about 80% of the blood to the brain. During a stroke, blood flow is already disrupted, either because a clot is blocking an artery, as in an ischemic stroke, which makes up about 87% of all cases, or because a blood vessel has burst, as in a hemorrhagic stroke. Adding any extra restriction to blood flow in such a situation is similar to squeezing a garden hose that is already partly blocked. Research published in the Journal of Emergency Medicine has shown that even slight external pressure on the neck, as little as 5 millimeters of mercury, can reduce blood flow to the brain by up to 15% in healthy individuals. For someone already having a stroke, this reduction can significantly speed up the damage to brain tissue. The action itself takes only a few seconds, as you simply need to unbutton the top 2 buttons of a shirt or blouse. Remove any tie completely instead of just loosening it. Unclasp any necklace or pendant. If you are wearing a turtleneck or a high-collared sweater, pull the fabric away from your neck as much as possible. For those wearing bras with tight bands, loosening or removing them can also help, since pressure around the chest can affect breathing efficiency. During a stroke, the brain needs as much oxygen as possible from every breath. This step is ranked at number 5 not because it is unimportant, but because it is simple and can be done almost automatically once you are aware of it. It also prepares the way for the more involved steps that come next. Many emergency room doctors have observed that patients who arrive with loosened clothing often show slightly better oxygen levels than those who arrive fully dressed. Although the difference may seem small, in stroke care, every percentage of oxygen delivery is extremely important. You should also loosen belts and any tight waistbands, since pressure around the abdomen can affect blood returning to the heart. The heart must work as efficiently as possible to maintain whatever blood flow is still reaching the brain through open vessels. This simple step takes less than 30 seconds and requires no special skill other than remembering to do it. Those few seconds of action can help preserve brain tissue that might otherwise be lost due to lack of oxygen. The next step requires more focused effort and deals with something happening inside the body that cannot be seen. Before moving on, press the like button and subscribe so you don't miss the next important tip. Number 4. Use the 4-7-8 breathing pattern immediately. When stroke symptoms begin, the natural human reaction is panic, and panic leads to rapid, shallow breathing that actually reduces the amount of oxygen reaching your brain at the exact moment when your brain needs it more than ever. This is not just about staying calm for comfort. There is strong scientific evidence showing that controlled breathing during a medical emergency can raise blood oxygen saturation by 8 to 12%, according to research conducted at Stanford University Medical Center. That difference directly affects how many brain cells are saved or lost. The method that emergency medicine specialists recommend is known as 4-7-8 breathing, and it works like this. You inhale slowly through your nose for a count of 4 seconds. You then hold that breath gently, without straining, for a count of 7 seconds. After that, you exhale slowly through your mouth for a count of 8 seconds. You continue repeating this cycle continuously while waiting for medical help to arrive. The reason this pattern is effective is that the longer exhale activates your parasympathetic nervous system, which is responsible for calming the body. When this system is activated, blood vessels relax slightly, allowing improved blood flow, including to the brain. In addition, holding your breath briefly gives more time for oxygen to move from your lungs into your bloodstream. During a stroke, it is critical that each heartbeat carries as much oxygen as possible. Researchers in Japan conducted a study published in the Circulation Journal, where they observed stroke patients who practiced controlled breathing compared to those who breathed normally before reaching the hospital. The group using controlled breathing showed noticeably better neurological outcomes when evaluated 72 hours after the stroke. For this method to be effective, it must be started as soon as symptoms are recognized and continued without interruption, even if fear or confusion is present. The body's natural response to fear will try to push breathing back into a fast and shallow pattern, so maintaining control is essential. If you are assisting someone who is having a stroke, it is helpful to breathe along with them in a clear and visible way so they can follow your rhythm. A person experiencing a stroke may struggle to understand spoken instructions, but they can often copy actions they see. Some individuals find it useful to practice this breathing method regularly while they are healthy so that it becomes automatic and requires no effort during an emergency. Practicing for just 2 minutes each day for about a week is usually enough to make it feel natural. The oxygen preserved through controlled breathing during those critical minutes is oxygen that your brain cells can use to survive until proper medical treatment restores blood flow. What comes next involves a timing detail that emergency room doctors consider the most valuable piece of information you can provide. Number 3. Note the exact time and say it out loud. This step may seem more administrative than medical, but it is extremely important to understand that knowing the exact moment when stroke symptoms began can determine whether doctors are able to use the most effective treatment available. If this information is incorrect or unknown, it can completely remove certain treatment options. The medication known as tissue plasminogen activator, often called TPA or referred to as the clot-busting drug, can dissolve blood clots that cause ischemic strokes and restore blood flow to the brain. However, it can only be given within a strict time window of 3 to 4.5 hours from when symptoms first appear. After that time frame, using TPA becomes too risky because the chance of causing bleeding in the brain becomes greater than the potential benefit. When stroke patients reach the emergency room and cannot tell doctors when their symptoms started, medical professionals often assume the worst-case timing, which may prevent the patient from receiving TPA, even if they were actually within the safe window. A study published in the New England Journal of Medicine changed how emergency departments handle this issue. It showed that patients who received TPA within 90 minutes of symptom onset were 2.5 times more likely to have little or no disability after 3 months compared to those who received it later within the allowed time. This means that every minute of uncertainty about timing reduces the chances of recovery. The action you need to take is simple but must be done intentionally. As soon as you notice symptoms such as facial drooping, arm weakness, or difficulty speaking, you should immediately check a clock or your phone and say the time out loud. For example, "It is 2:47 in the afternoon and I am having stroke symptoms." Saying it out loud serves two purposes. It helps fix the time in your memory, even if the stroke begins to affect your thinking, and it creates an audible record that others nearby can hear and remember if you later become unable to communicate. If you are alone, you should also try to write the time down or send a message to someone, since having a recorded time is extremely valuable. If your phone is nearby, calling emergency services first and then asking them for the current time creates an official timestamp in the dispatch records. Some neurologists suggest that seniors keep a small notepad and pen in each room of their home for this exact reason, because searching for something to write with can waste valuable time, and writing the time down helps reinforce memory. When paramedics arrive, the first thing you should say is the time your symptoms began before saying anything else, because this information will be passed on to the hospital and will affect every treatment decision that follows. The next step involves positioning your body in a way that allows gravity to help support your condition. Number 2. Lower your head below your heart level. The position of your body during a stroke affects how blood flows inside your skull. While this may sound simple, research from the University of Texas Southwestern Medical Center has shown that body positioning during the acute phase of a stroke can influence how much brain tissue survives. For most strokes, which are ischemic strokes caused by blood clots blocking arteries, lying flat with your head slightly lower than your heart allows gravity to help direct blood flow toward the brain rather than working against it. This principle is well established and is now included in advanced stroke life support training for emergency medical personnel. To do this, lie on your back on a flat surface such as the floor or a bed without using pillows. If possible, slightly raise your legs by placing a pillow or a folded blanket under your calves, which further helps move blood toward your upper body and brain. Research published in the journal Stroke found that patients who stayed upright before reaching the hospital had lower blood flow velocity in their brain arteries compared to those who were lying flat. Lower blood flow during a stroke means less oxygen reaching brain tissue that is already deprived. However, there is an important exception to this advice. If a person is vomiting, having trouble breathing, or losing consciousness, they should be placed on their side in what is known as the recovery position to prevent choking. Keeping the airway clear must always come before improving blood flow. The recovery position involves placing the person on their left side with the top knee bent forward for stability and the head supported but slightly tilted downward so that any fluid in the mouth drains out instead of going back into the throat. If you are experiencing symptoms yourself and are unsure whether to lie flat or use the recovery position, the general guidance is to lie flat if your breathing is normal and you feel stable, but turn onto your side if you feel nauseous or think you may vomit. Some people hesitate to lie on the floor because they worry about getting back up, but emergency responders are trained to assist patients from the ground and would much rather find you safely lying down than see that you have fallen while trying to remain upright. This step is ranked at number 2 because it is an active intervention that can truly affect the outcome, and the research supporting positioning during a stroke is strong enough that many ambulance services now include specific positioning protocols during transport. Now we come to the action that researchers in Sweden say may be the most important step a person can take during a stroke emergency. Number 1. Perform the 3-minute skull pressure release technique. The research that came from the Karolinska Institute in Sweden changed how neurologists understand what happens inside the skull during the first minutes of a stroke. It focuses on something known as intracranial pressure, which is the pressure inside the skull created by the brain, blood, and cerebrospinal fluid all sharing space within a fixed bony structure. When a stroke happens, the affected part of the brain begins to swell almost immediately as cells are damaged and fluid builds up. This swelling increases intracranial pressure, which then compresses blood vessels and reduces blood flow not only to the damaged area but also to the surrounding healthy brain tissue. This creates a harmful cycle where the initial damage spreads outward, similar to ripples in water. The 3-minute technique developed and tested by Swedish researchers involves lying completely still in a flat position and then consciously relaxing every muscle in the face, jaw, neck, and shoulders while breathing slowly. The reason this method works is connected to the relationship between muscle tension and blood drainage from the brain. When you clench your jaw or tighten your neck muscles, which is a natural reaction when feeling afraid, you put pressure on the jugular veins that carry blood away from the brain. When blood cannot drain properly, intracranial pressure increases even more. By intentionally relaxing these muscles for a continuous period of 3 minutes, blood can drain more effectively from the skull, lowering intracranial pressure and giving the brain tissue around the affected area a better chance to survive until medical help arrives. The study that introduced this method followed more than 400 stroke patients and found that those who stayed still and relaxed before reaching the hospital had noticeably smaller areas of brain damage on imaging scans compared to patients who were restless or moving around. The difference was most significant in the penumbra zone, which is the area of brain tissue surrounding the main stroke site that is damaged but not yet permanently lost. To perform this technique, first lie flat as explained in the previous step. Then consciously relax your jaw by allowing your mouth to open slightly. Let your tongue rest loosely instead of pressing against your teeth. Allow your facial muscles to become completely relaxed, even if it feels unusual. Then relax your shoulders by imagining them sinking into the surface beneath you. Maintain this fully relaxed state for a complete 3 minutes without moving, speaking, or checking your phone. If someone is with you, they should keep track of the time and inform you when 3 minutes have passed. The mental part of this method is just as important as the physical part. You must resist the strong urge to move, check your symptoms, or react to fear. Focusing on staying relaxed gives your mind something to concentrate on instead of panic. Many stroke survivors who later learned about this method expressed regret that they did not know it earlier, as they spent their waiting time pacing, repeatedly sitting up to check for help, and keeping their muscles tense due to fear, which may have negatively affected their outcome. The science of managing intracranial pressure is well established in hospitals, where patients are given medications and sometimes undergo procedures to reduce pressure. The idea of reducing pressure before reaching the hospital through positioning and muscle relaxation is a newer application of the same principles. Neurologists who reviewed the Swedish research noted that this method requires no cost, no equipment, carries no risk, and can be performed by anyone regardless of age or physical condition. This makes it one of the most valuable pieces of stroke survival information that many people are unaware of. The 3-minute duration was selected because research showed that shorter periods did not consistently reduce pressure, while longer periods did not provide additional benefit. 3 minutes was identified as the most effective duration before moving on to other supportive actions. These 5 actions represent everything that current medical science suggests a person can do during the critical minutes between recognizing stroke symptoms and receiving professional medical care. While none of them replace emergency treatment, they create the best possible conditions for the brain to survive until help arrives. The combination of removing tight clothing to improve blood flow, controlling breathing to increase oxygen, noting the exact time to support treatment decisions, positioning the body to use gravity, and performing the 3-minute pressure release technique to protect vulnerable brain tissue gives a person an active role in their own survival rather than leaving them helpless while waiting for assistance. Each of these actions is supported by peer-reviewed research published in respected medical journals, and every one of them can be performed without special training or equipment by people of any age or physical ability. Statistics on stroke recovery clearly show that outcomes improve when action is taken early. While we often think of intervention as something done by medical professionals, these 5 steps are real actions that can be taken immediately at home during the most critical stage of a stroke. If you are over 65, you should practice these steps regularly until they become automatic, because during a real stroke your thinking ability may be affected, and automatic responses could save your life. If you care about someone who is older, share this information with them today, because knowing these steps before a stroke happens is far more valuable than learning them afterward. If you found this information helpful, please subscribe to this channel so you do not miss future videos that could help protect your health or the health of someone you care about. Thank you for watching.